hydrochlorothiazide, a very popular blood pressure medication. And I should say, we don't just use it for blood pressure. We use it for swelling. We use it for heart failure. Sometimes it's used for kidney stones. It's used for a lot of different things. But I would say in my practice as a family physician, the most common reason I'm using it is for blood pressure. That's also the most common reason my patients are on it. By the way, when I say hydrochlorothiazide, it's often also known as HCTZ. So by the way, let me know in the comments, are you on HCTZ? I think this is literally probably one of the most, if not the most popular or common rather, blood pressure medication. All right, a few things you should know about this medication. It is a thiazide diuretic. Let's start with the word diuretic. What that means is one of the ways it works is it helps you pee, okay? It inhibits sodium reabsorption and in the kidney, and it allows increased salt and water removal along with some other electrolytes, etc. It causes you to pee, and that's one of the ways that it does what it does, okay? I should also say that there are other mechanisms of action as well, some of which are poorly understood. So one of the things people will notice, my patients and others will notice, is that they tend to have to pee a lot on this medication. It's one of the reasons why a lot of times we do not recommend taking this at night, because you might just be peeing during the night. Of course, I am not your doctor. Make sure you're checking with your doctor about what you should be doing and what you shouldn't be doing, okay? But this is a medication in pill form. We often use lower sort of doses. We don't usually use the higher doses of HCTZ. And there are other medications in this class of thiazide diuretics. It's just that HCTZ or hydrochlorothiazide is probably the most commonly used version of the thiazide diuretic. So let's talk a little bit about side effects and things that you might have or might experience. I'm going to give you some side effects that we know are common. I'm going to tell you which ones I tend to see mostly in my practice. By the way, if I have not introduced myself, which I don't think I have, I am Dr. Jen Caudle. I'm a practicing family physician, on-air health expert, and video creator. I do daily videos. Okay. So one of the more common things I see with HCTZ is what we call electrolyte imbalances. That's just a fancy schmancy way of saying that your electrolytes can become a little wonky when you take HCTZ. By the way, this does not happen to everyone, but it does happen to many people. Now, when I say electrolytes, what am I talking about? I'm talking about things like sodium. It is not uncommon to have a lower sodium as a result of taking HCTZ. Also, potassium. This is probably the most common electrolyte imbalance that I see in my practice. People have low potassiums or may have a lower potassium because of this medication. And sometimes rather, I have to give patients potassium to take or fix it or what have you, or we have to change the medication or something. But yes, HCTZ can lower potassium. It can also lower magnesium, and it can also, well, okay, I'm going to tell you that one in just a second. I'm going to stick with electrolytes for a second. In some people, it can increase calcium levels, so sometimes we have to be very, very thoughtful about that. Also, it potentially, we're moving off of electrolytes, but potentially could increase sugar and cholesterol levels. I know you guys you're probably going to say, well, wait a minute, then why do we use this medicine if it can increase my blood sugar and cholesterol and lower the potassium? And you know what, if you're saying that, I get it. You're right to ask this question. And I've done other videos on other blood pressure medications, such as amlodipine, which is a calcium channel blocker, lisinopril, which is an ACE inhibitor. Remember that all of these medications, and basically every medication, prescription or not, also supplements, vitamins, etc., botanicals, they all have potential side effects. Meaning it's just sort of a fact of life that there are things that can happen. What we do is we have to weigh the risk of these things happening and the severity of them and how it might affect your health. We have to weigh the risks versus the potential benefits. And for some people, taking something like HCTZ does not make sense. But for many people, yes, it does, even despite some of the side effects that I'm telling you about, okay? So to answer your question, okay, well then why are we taking this if you can lower your sodium and lower your magnesium and da-da-da-da, okay? It's because, well, number one, oftentimes many of the other medications that patients are on, so oftentimes people who are taking HCTZ happen to be on other medications, whether for blood pressure or other things. Oftentimes, or many times, those medications can actually reduce the effects, okay, or the potential side effects of the HCTZ, meaning may make the electrolyte imbalances, for example, less obvious or less present. So if somebody, for example, is on an ACE inhibitor along with their HCTZ, like lisinopril or something, that could maybe get rid of or deal properly with a question about low potassium. Does that make sense? So in other words, it's not that this happens to everyone, but it can happen. Okay. Now, so those are some electrolyte imbalances that can happen, etc. Now, let me tell you another potential side effect that I'm often thinking about. So HCTZ or hydrochlorothiazide can increase uric acid levels. That can put you at risk for things like gout. And I have to tell you, this is something that I am often thinking about, that I have patients with gout. I am very, very, very careful about whether they are on HCTZ or not. More likely the latter than not, because again, HCTZ can potentially increase uric acid, which could make gout worse or precipitate it, etc. Okay, so that's something to keep in mind there. Other things that we may see with HCTZ, there is the possibility for sexual side effects. Okay, that's not the only medication where this exists. And by the way, most people do not have sexual side effects, but just know it's a possibility. I don't know that I've had many patients where we've concluded that it's the HCTZ, but yeah, there's a number of blood pressure medications that fall into this category. I would also say that there have been some studies and some research that has shown that hydrochlorothiazide has been associated potentially with an increase in skin cancer. Okay, and this is the thing: if you pull out what we call the prescriber's information, or like the adverse side effects, like the handout that the pharmacist gives you with your HCTZ, you're going to see a whole lot of side effects that it can potentially cause: dizziness, lightheadedness, etc. And this is the thing. Most people will not have those side effects, but yes, when we lower your blood pressure, you may feel certain things. You may have certain side effects, etc. So this is just to say, this video is not to scare you. It's to let you know that, first of all, with any medication, over-the-counter medication, botanical supplement, etc., there is the potential for side effects. That should not scare you off. No, because we know pretty much everything can have side effects. Okay, understand that's a baseline. What you want to know is if the medicine is right for you. Okay, so I have some people that have maybe urinary issues where they already urinate too much. So maybe I'm going to be very, very thoughtful about putting them on a water pill that may make them urinate more. This is the type of thing, and these are the things I want you to be having conversations with your doctor about. Okay, don't let side effects scare you. Just understand what they potentially can be. Ask your doctor, and it's with you and your doctor making sure that this is the right medication for you. There are plenty of other potential side effects of HCTZ. These are just a few. Honestly, this is just a few. I'm just skimming the tip of the iceberg. These are ones that I typically see. But yeah, I hope this is helpful. Maybe I'll do another video on more potential side effects, etc., things you should know. But let me know if you're on this medication, if you know someone who is. I bet we pretty much all know somebody who is. I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. I do daily videos. Please like and follow my page on Facebook. On YouTube, please subscribe to my channel. Click the little bell for updates. Guys, also, I'm on TikTok, WhatsApp, Instagram, etc. at Dr. Jen Caudle. Also, I have a free health newsletter. I would love for you to subscribe. Please go to www.drjencaudle.com and sign up for my free health newsletter. Guys, I hope this is helpful. Again, just the tip of the iceberg. This is not a complete review of HCTZ. And as much as I wish I were your doctor, I am not. You need to check in with your doctor. But I should also say, this is one thing I didn't say. HCTZ works quite well for a lot of people, okay? So make sure you're asking your doctor any questions you have. Hope this is helpful. All right, guys, bye.